Britt, and I'm the Workforce and Adult Services Consultant with the Department for Libraries and Archives. And I just want to thank you all for being here for today's webinar, Targeted Orientation Sessions, Community Collaboration to Support At-Risk Populations. Today's webinar is being sponsored by the Institute of Museum and Library Services, so we want to thank them for providing this opportunity. And if you have any questions about the content that's shared today, please put those in the chat. My colleague Tricia and I will be monitoring that. Aaron Poynter is our presenter. He is with the Office of Adult Education, and he's the Director of Reentry Services. A couple of other things. We are recording today's webinar. It will be made available soon when we can in the next few days, and then the slides will also be made available to you, and captions are available. Our captioner has put the stream text link in the chat, and then you can also just join. Captions should be available through Blackboard as well. But if you have any questions, please don't hesitate to put those in the chat. And without further ado, I'm going to turn it over to Aaron. I'm going to get his slides up and let him start sharing. I know he's got a lot of great content to share, and so thank you, Aaron, and I'll let you take it away.
All right, so can everybody hear me? I've experienced sometimes they say, oh, you sound really far away, so I'm going to try to stay really close and engaged during the webinar. So, okay, great. So, like I said, my name is Aaron Poynter, and I'm the director of the Reentry and Employment Services branch with the Office of Adult Education in the Education Labor Cabinet. So, we're all part of the same family, if you will, right? And what I want to talk today is about how we can deepen our partnerships with libraries throughout the state. I personally am a huge fan of our local public library. Me and my family are frequent visitors. My little girl just went on a field trip to the library, and her excitement when she was talking about it, it's like she'd never been there before. She was so excited to go back to the library, and that's so there, I have a deep love for it. I also utilize our library for a lot of the extracurricular stuff that I do outside of my actual job, various meetings, and just using that as like a really good gathering point and focal point for a lot of the things that I'm involved in. So just know when I am talking, when I'm talking and presenting, it's done out of deep love for libraries. Okay, so with that, we're going to get started, and I kind of want to set the stage for some of the things that we're going to be talking about. I see reentry as workforce, community, and economic development. And we're going to talk about how libraries are very much a huge part of that, and how we can go to the next level. So I'm not going to read what our mission and vision statement are. You can have a look at that. But what we really want to do within my branch is to align those state, local, and regional resources to serve people. To really get them engaged, remove barriers to workforce, and to get people engaged back into the workforce, back working. And I feel like a great way to do that is through our community hubs, the local libraries, right? So before we kind of get really involved, I want to talk about how being justice involved is a spectrum. A lot of the times when you hear reentry, you'll think of people that have been to prison, or your mind tends to venture to an extreme level, which is true, but not all the time. Being justice involved could be a speeding ticket, could be no insurance ticket, could be child support. One of the funny stories, or one of the things that I like to talk about, is you can become a felon in Kentucky if you're $1,000 behind on your child support. Right. And so that kind of offers, a wider scope to look at things. It could be the 18-year-old that gets the speeding ticket, right? They're justice impacted. Or it could be an individual that served some sort of long-term incarceration. So it's very much a wide spectrum, but that spectrum encompasses one true fact of they are Kentuckians, they are members of our communities, and we need to support them. And supporting them affects everybody. And this leads me to my second point: is reentry is not one program; it is an entire system. We like to talk about workforce as the workforce system. Reentry is another part of the system, right, within those communities. It is the justice system or the judicial system. It is the workforce system. It is the social services. It is community development. It engages the healthcare system, and we're going to talk about that here in just a little bit. But what I want you to I guess glean from this is the fact that everybody or all of these different agencies and organizations will pour in to these individuals as a part of that system. And I like to use it, you may have heard this called a system of care, right? And that's what we're doing. We're just developing a more robust and a deeper system of care for individuals to help them along their path. Okay. So one way that we do this, our core program is called Putting Kentuckians First, and there you can see just a little graphic of how Putting Kentuckians First work. And so my branch acts as what I would say is a central nervous system within a lot of our communities, accepting judicial referrals, jail referrals. Individuals that have been impacted by the judicial system or the justice system, and bringing them to one location or having one point of contact to help them navigate how to break some of these cycles that they're in, right? That cycle of maybe offense and then incarceration, and then they get out and then they mess up again, or they cannot pay their fines, or whatever that looks like. It's a cycle that can really be detrimental to the individual, to families, and then of course to communities. And so what we want to do is we want to serve as that central nervous system and start making those connections from the judicial side of things to our partner agencies, our employers, and of course, the workforce system as a whole. One really clear way, and it was the title of this webinar, right, is our targeted orientation classes. And so what we do there is we establish a solidified date and time that agencies can refer individuals to come to a targeted orientation class. And what we do in those classes is we bring all the resources to our communities, right, to that location, and we meet with those individuals and we give them kind of an overview of, hey, I'm Aaron Poynter, I'm with the Reentry and Employment Services branch, and this is what we do, right? We also bring our other workforce development partners and our workforce system partners in at the same time. And so we'll have somebody from the Office of Vocational Rehabilitation or the Career Development Office or the Office of Adult Education, specifically those local providers, and they say, hey, I'm so-and-so, and this is what we do. This is how we can help. And then immediately, it's not just informational, it's actionable. We start asking these individuals, what brings you in here today? How can we help? Right. And I'll use a really, really easy example. If somebody comes in and they say, hey, I need my GED. Well, we're immediately connecting them to those resources in real time to start scheduling those appointments, to start doing some of that intake paperwork, to start mapping out what are the next steps. You know, we're going to go to the GED, but what other things are going on that we can help support you in doing that, right? So that's really the basis of our targeted orientation classes, and we are seeing a tremendous amount of success by creating those in concrete, solid, usually unmovable dates and times that our jails know where to send people. Our county attorneys, our Commonwealth attorneys, our public advocates, they know that we're going to be at these locations within our communities, and we'll talk about some of those here in a second, on this date at this time to really start that engagement. And it's huge, it's impactful. We have seen individuals that were homeless sit in the same class as individuals that were retirees, you know, looking for that next, you know, maybe something part-time or some of that part-time employment, and maybe needed some additional services. So again, I just think it's a super awesome way to get people engaged and make it actionable immediately. So get me a drink real quick. This is a map of our operations. The highlighted map shows where we have a dedicated navigator. And what that means, that's just a member of my team that goes out and serves all of these counties. Another thing that means is if your county is highlighted, we are hosting a targeted orientation in your county. We do, you know, direct client-facing operations within the counties that you are observing there, and we are very active, right? We have we're having the referrals come in. We're getting people back to work. We're moving mountains in some of those cases, and so the reason for this is some of the counties have experienced, you know, a lower rate of participation, and perhaps it's because of the location. And so, as we were talking about, you know, some of our options of where to move them or where to have these targeted orientations, public libraries immediately come to the front of my mind, right? If we're able to have that, and that serves two purposes. One, most everybody knows where your public library is, and I think that is just again a wonderful place of resource and information. And so by activating that and asking to host some of our targeted orientation classes, it's going to serve two purposes, right? It's going to get people in front of us and they know where it's at. And it's also going to drive foot traffic into those locations, right? And our goal always with everybody that we interact with, we want that repeat customer. We want them to leave in a better situation than they walk through the door, equipped with better resources, information, education, right? And I feel again, the libraries, you know, that would be in the dictionary beside a library, right? So you've seen where I'll go back. So that is where our Pudding Kentuckians' first operations are. We also oversee Senate Bill 90, which is the Behavioral Health Conditional Dismissal Program. And so there's some overlap, as you can see, but those are our pilot counties. And again, we just have staff that are specifically allocated to those areas and to those colored in counties, overseeing a program called Senate Bill 90. And it is just to help divert individuals that have made a bad choice. And if they complete the program, their criminal charges are dismissed. And so it gives them access to behavioral health treatment, substance abuse treatment, and some of those resources. And we specifically oversee the education, training, and workforce component of that. And again, we're seeing just a lot of growth with participants and with success, right? By really activating all the components and all those resources to pour into those individuals, we're seeing a tremendous amount of success. And I'll share some stories with you towards the end of this presentation. And so, bringing it up, or kind of bringing it around to what I was talking about with those targeted orientation classes. So you can see two flyers there. The Pudding Kentuckians First initiative, and I'll be available, and I can send this out to you all. But that just really kind of goes through and explains all the resources that my branch and the workforce system collectively can do for individuals. It lists our navigators, how to get a hold of them, how to contact them. And this is one really cool thing that I did want to share with you all. Being a partner with us and having the flyers and stuff, these are not numbers that just ring to an office or to an answer machine. The numbers listed go to the cell phone, right, that I have sitting right here beside me, that my staff have in their pockets. And unless they're in if they're in a meeting, they may let it go to voicemail. But for the most part, when you call that number, you're getting a hold of a person, right? You're going to be able to talk to a person. You're going to be able to leave a message, and that person is going to call you back. That's one thing in working with this population, or with the reentry or the justice impacted population, we are very adamant about. We are going to call you back. We are going to give you the resources you need, and we're going to walk with you every step of the way. So you see the Pudding Kentuckians First flyer there. Also, I'll shift over and talk about the targeted services orientation. Again, you see the list of services that are listed there. All the partners that are involved. This one's specifically for Hardin and LaRue counties. But I want to call your attention down to the lower right-hand corner of that. And so it's the third Friday of every month from 9 until 10:30 a.m. Eastern time. And there's the address. And that is set in stone, right? Those are things that on the third Friday of every month, we're going to have a team member there ready to serve, ready to get people engaged, ready to help them with the access to resources that they need. And so you'll see that one is held at the Hardin County Adult Ed, which is on ECTC's campus. Again, we are going through a phase where we're looking to identify other partners and other places to host these. If you'll look just directly to the left, you'll also see a photo of one of my team members. His name is Michael Updegraff. You may have met him, and that's his cell phone number, right? So not only are the people that are receiving this, they're getting a kind of an introduction to what we can do, but they also know who they're going to meet with, who's going to be there to be that main point of contact, and how to contact them maybe before they come in. And so again, just that connectivity and making sure that people are connected, they're aware of what they're coming into, who they're going to be talking to. We've just seen a lot of success with that. Also, count me as not a webinar master, but if you have any questions, feel free to toss them in the chat. I'm occasionally looking over at the chat. So if you have a question, a comment, something that you want me to go back to and kind of expand on, would be more than happy to do so. I think that I want to make sure that I am telling you all everything that you need to know or that you'd like to know about our branch, our services, and what we can do. So going back, or kind of continuing on, one of the main thoughts that we say is it isn't top down or bottom up, right? This is all hands on deck. And when I'm talking about that, I think we are all stakeholders in serving our community and serving those Kentuckians, right? The core program's called Putting Kentuckians First, and that's what it's about. It can't be an initiative that we say like, hey, forget everything you knew and do it our way, right? And it can't be something that we just come in and kind of kick the door in. That's what I tell a lot of the counties is we're not coming in and saying, hey, forget everything you thought you knew about reentry. We're saying like, hey, how do we build this together, right? What is your comfort level with directing people to come into the libraries and to have some of that targeted programming, right? it's all hands on deck, and we're all stakeholders in this. And I'll go a little deeper into some of the specifics about being all hands on deck. But one thing that I think is really meaningful is access to technology, right? And some of that digital literacy. I know that in our library and most every library I've been in, access to be able to computers for job searches, right? To work on a resume, to do some printing. All of those things are super valuable, and a lot of times we take for granted our access to technology, our access to be able to print things, our access to information in general, how to navigate a lot of things. And so it is an all hands on deck to provide that access and to provide those resources to individuals. And when we're doing this together, nobody feels alone, not only from a partner standpoint, right, that they've got to solve everything, but also for that individual. That individual feels supported, they are supported, and they're able to progress, right, and go through and make that next right choice every single time. And so I think that's really huge. And so I do want to talk about what reentry ready is, really from a community standpoint. And our targeted orientation classes are a key component to a community being reentry ready. Right now, that's not an official designation putting out, but it's a concept, right? It's a frame of mind. Is what is reentry ready? And so I'll ask you this, just a kind of hypothetical question, a rhetorical question. You don't have to answer, but if you had somebody that walked through the door that was just as impacted, right? And sometimes they're forthcoming, sometimes they're not, but they needed resources. Are you and your staff ready to serve them? Are you ready to direct them in the best possible way? Are you ready to get them connected to career managers or social services or any number of barriers or lists that you can think of? Are you prepared as a public building with client-facing staff, right, with public-facing staff to handle some of those situations? Now, I'm going to venture out and say you're probably thinking of situations that you've already experienced, right? That you've thought about, and you're like, man, this individual walked in and they were asking some questions, and I was able to kind of help them out. But I sure wish that I would have had somebody better to call, right? That next step. And that's part of that being reentry ready. And a lot of it is just that education and just that awareness as a library, as just a member of the public, is if somebody comes and expresses a need, right? They're seeking help. What do we do? Where do we go? And so I would venture to say, if there was a targeted orientation class that was set up and hosted at the library, it would be really cool, not only for that person to be able to say, hey, we're having a targeted orientation class next week. I really think the stuff that you're asking, they can help answer. Or if that person needs immediate help, that relationship with those people or with us, you can reach out to us and we can get engaged immediately. And then also, and here's a huge benefit, and this is something that I've seen in multiple, I have multiple examples of staff coming to one of the programs, either a targeted orientation class or a pre-release program, and just listening to how the agencies communicate with a participant, right? Listening to, I can get up here and I can tell you all the great things that I do every single day and all the great things that my staff does every single day. But once you hear one of my team members talking to a participant or to an individual in need, a lot of light bulbs start going off and a lot of those connections start to be made. And they're like, wow, I had no idea that was available. And I'm going to give you a really prime example, right? This is for a workforce board. So I'm going to use the Cumberland's workforce board, and really it applies to all of them, but they have a program called Putting Young Kentuckians to Work. And that is funding that's available to help pay for training that leads to employment for individuals that are 16 to 24 years old. I think back to myself, my in my own past, is how valuable would that have been to know when I was 16 to 24, right? There's funding available that's going to help me with school, with training, with whatever I'm seeking as far as my entry into the workforce. And it's right there, and you just have to know where to send somebody to access those opportunities. I heard Dr. Aaron Thompson talk, and he said that if somebody doesn't know about an opportunity, there's no opportunity, right? It was something along those lines that he said, and that really resonated with me. Is a lot of it is just knowing where to send people and knowing how to give them access to so many of the resources that are out there to help them take those next steps. And so why does it matter, right? That's kind of the question that I get sometimes. And as I travel all over the state and I meet with people, they don't ask it that rudely, right? They don't ask it that rudely, but they do ask, what's in it for me? Why does this matter? And so in thinking about that, I'm going to talk about why does it matter to us, not in our professional lives, but just us as citizens, right? Us as working Kentuckians. One, because 95% of the individuals that are currently incarcerated are going to get out. Okay. There's a huge number of individuals that'll never experience long-term incarceration, but they are justice impacted. Okay. Those are individuals that their kids go to school where our kids go to school, right? Where my little girl goes to school, there are justice impacted parents. Okay. They go shopping at Kroger just like I go shopping at Kroger. They go to the same football games and community events. And so when we're thinking about that, we want to help equip those individuals to be the best version of themselves, right? They're a member of our community, and strengthening those individuals strengthens our community. I go farther into saying, we're all taxpayers, right? And so taking individuals or helping individuals through the process that goes from being dependent on social services, right, to a level of self-sufficiency, that's huge. And that's an economic development conversation, and that is something that directly impacts our lives, right? And so that's why it matters, and that's why it matters to me. I'll take you another step farther. Another reason why it matters to me is I have seen time and time and time again individuals go from some of the lowest parts of their life, right? You'd say rock bottom, into a level of success where they've got their children back, right? There's families reunited. They're having promotions. I had this young man. He met me in a parking lot back a few years ago, and he had the clothes on his back, and that's it. He needed some healthcare things resolved. He needed employment. He needed identification. He needed all of these things. And we start to work with him, right? We got to work with him. Not too long ago, I seen him at his place of employment, and he was just sharing how he's good, right? His life is so much better. He's got his kids back. He said he was able to, during back to school shopping, right? He was able to take his kid back to school shopping and get new clothes for that school year. That's awesome, right? It doesn't just affect that one individual. This is affecting many individuals down the line. So that's why it matters to me. So another reason why it matters, kind of on a larger scale, is providing this access and having this reentry ready and this framework and this mindset as we move forward, is we see kind of the larger picture, right? In 2024, from 2023, there was a 30% decrease in overdose deaths, right? Somebody's family member, somebody's friend, somebody's mom, dad, brother, sister, however you want to look at it, there was a 30% decrease in overdose deaths. Those are individuals that are within our community, that are still with us, right? Because they have access to the resources and the services and the help that they need. Another one is just this is an outstanding fact and statistic, is nearly 70% of individuals released from state custody in 2022, they have not been reincarcerated, right? By providing the resources to help people go from where they're currently at to a level of success and self-sufficiency, they're not reoffending, right? And that's huge. And here's another one, and I don't know, for anybody that doesn't know me, I used to be a police officer in a past life, right? Feels like a lifetime ago before I got into workforce development. But you can see nearly an 8% decrease in serious crime offenses, right? We keep dropping those and giving opportunity to individuals, and those violent crimes continue to decrease. That affects our community. That's a public safety initiative right there in itself. And so those are some really, really big pictures. Those are some really, really big ideas to be thinking about, but it does impact us, not only within our communities, but us as individuals, right? I don't want to be the victim of a serious crime, right? I don't want somebody that is close to me that's maybe suffering with substance use disorder or opioid use disorder to be in that statistic of overdose deaths. And so it's very huge. And I love seeing such a high number of individuals that are getting out, getting equipped, and not reoffending, right? So here's another statistic of why it matters. Okay, and this is talking about individuals that are, I hesitate to use the word inmate, but when inmates participate in educational program, the recidivism rate drops significantly. So I'm going to ask a question. Again, you don't have to answer. If you know the answer, feel free to throw it in the chat. But who pays to run our jails? Or how are our jails funded? If you thought to yourself that it's tax dollars, then you are correct. So that's the thing is when we pay our taxes and the county taxes, the counties fund our local jails. Our taxes fund the correctional facilities. And so when thinking about that, if we can keep more people from going to jail and racking up that daily rate of $30, $40, or $50 a day while they're in jail, and give them something else so they don't come back. Think about how much money our counties and our state would be saving, right? And so for every $1 spent on education programs, $4 is saved on reincarceration costs. That's the level one statistic. And so then you think about that same individual that gets out, that now we're saving on their reincarceration costs, but now they are working a job. Okay, so then you've got some tax, some payroll tax, and some things like that coming in. Our employers are supported. They're able to thrive and grow because they have a ready workforce. And then those same individuals are getting a paycheck. Okay, and where are they going to spend that paycheck? In our communities, right? They're re-injecting those funds that they've earned back into our communities at the same time as all the other cost savings and all the other physically responsible things that are going on. And so I think that's really huge to think about. And again, being a part of the solution by helping give access to vocational training and post-secondary education, and that entire spectrum that oftentimes starts with a GED, right? Starts with that high school equivalency. And Miss Hillary told me, she was like, yeah, a lot of our, and I knew this as well to a point, but a lot of our libraries are GED testing centers, right? You all are a partner in this, and you are a stop on the journey to somebody changing their life through education. And so I think that's such a huge benefit. And that's something that right there we can sit and think about. Wow, every $1 spent on educational programs, it's saved on reincarceration costs. And that same concept can be applied earlier in the process, that every bit of investment that we give to somebody that diverts them from criminal behavior and continuing to matriculate through the justice system, that is cost savings, right? That is saving us money in the long run, and that's huge. And so I love to brag on my team members. And I want to show you, this is why we do what we do. This is how we have expanded over the last 2 fiscal years. And I can go ahead and tell you, we are on pace to really make an even larger increase and a bigger dent in this reentry work. And so you see some of our numbers. And the one thing that I do want to point out, and I'm going to try this trick that Miss Hillary taught me. Hopefully you can see my pointer now.
Yes, sir.
But we served 1,100 incarcerated individuals through our pre-release classes. The next year, it was 2,300. And I think that's so huge. That's 627. That's individuals that are just needing some direction, needing some pointing them in the right direction and equipping them with some resources. One other stat that I'm very, very proud of is that 525 IDs and birth certificates provided. And so I want to share this with everybody on the call, is our branch has allocated funding to provide IDs and birth certificates, those identification documents to individuals, because that is such a crucial piece of the reentry or the self-sufficiency puzzle that we try to work with individuals, right? You cannot get a job unless you have an identification. That's just the truth of the matter. Oftentimes, you can't access food banks and resources such as that unless you have an ID. Applying for social services and things such as that, right? It requires identification. The only stipulation that's put on us providing that to somebody is they have to be involved with our branch, doing the things, making those next right choices, getting access to those resources, or adult education, right? Sometimes individuals have to have an ID to be able to take their GED test. And so we do not want an $11 or a $22 piece of plastic being a barrier to that person going on and getting the next step, right? And so the last thing I will point out is 610 positive employment outcomes. And what that means that people that got jobs and stayed in their jobs. And it was about a 75.87% of employment and retention. And that is huge. That is really, really meaningful to the work we do, because we are a workforce development initiative. And those 610 people that are now taxpayers, that are now working their path to self-sufficiency. And again, just like the individual that I told you the story about, that are able to provide for their families, to have that sense of purpose. And I think it's just a wonderful thing. You'll look down and you'll see that we had 141 pre-release classes and 231 targeted orientation classes, right? So when I was telling you that we are there, no matter what, we are having those community-based targeted orientation classes in our communities at that rate, and we are again on pace to just destroy that number. And the last thing that I'm going to talk about, I'm going to mention it again here in a minute, specifically for libraries, library staff, and community personnel. But we trained 549 state and workforce partners. So our branch offers a few different classes and certifications that are really to help equip individuals to not only serve the justice impacted population, but really the community at large. And we're going to talk about that here in just a second. I'll give you a lot more information in just a moment. But that's some of the metrics we track that measure our success. And so I hopefully you can see just the sheer number of individuals that my team, not I, right, not I, but my team are impacting every year. And so I want to go back to the concept of how we're all in this together, and it's a stair step, right? Now the eaves can be interchanged, but we know that intentionality in this it impacts workforce, it impacts public safety, it impacts our education, judicial, social services, our faith-based community, and it's all economic development, right? All of these things work together for individuals and impacts each one of these aspects of our life and of our communities, right? Both on that micro scale when you're thinking about our individual communities, but also in the bigger picture, right? And so I love this kind of visual of how it is this stair step and how we can engage every piece of this, and an individual will touch every single portion of these stairs on their journey to being self-sufficient and taking it to the next level. And so to start summing up, right, as our time starts to dwindle together, what we do for individuals. And when I say we, I'm not talking about just the RES branch. I'm talking about that collective workforce, community building, like all of us in this thing together, right? We're extending the reach of the Kentucky workforce system. And this is one thing that I do want to point out. If you lived in Monroe County, Kentucky, if you know where that's at, your closest Kentucky Career Center is in Bowling Green, or you can come up sometimes to Columbia, but Russell Springs is your other brick and mortar Kentucky Career Center. Sometimes that drive might as well be on the other side of the country. Some people can't make it there, right? But by taking the tools of the workforce system and putting it in our communities, where it's readily accessible, where it's people know about it, where people can come and access those opportunities. That's our goal, right? We want to extend the reach of the workforce system and make it extremely local. We want to be in front of these individuals. We want to engage them and activate and really just help them along in their journey. And we know how meaningful that is. We want those mutually reinforcing activities and us to work together, right? I always say co-enrollment is not a bad word. So somebody being able to work with a faith-based organization and our branch and the WIOA partners, right? The workforce board and the career manager stuff. There's no rule against all that. And when we look and we pour in together, we can extend those resources and those services we offer from a very fixed, maybe 2-3 weeks. I've seen in some scenarios and instances, people have a sense or that on ramp extend for months at a time, and by the time they get to the end of it, they're equipped and ready to go, and they're being productive members of society, right? And again, kind of the same, and kind of going into the same as that first point, is really that community presence, where people within our communities know what we can do, right? I go back and I think about my own self, right? When I was, in college or, experiencing struggle in my life, I know already that I didn't know all the resources that would have been available to me to make life a little bit easier. And that's huge. And so it's education all around within the community. So our four partners, right? And this is what I want to talk about with the libraries is referrals and traffic, right? Again, changing that, not changing the narrative, but maybe educating on a much more frequent basis of all the resources that are available in our libraries and referring and getting some of that traffic, some of that foot traffic into our libraries or our other partners, just to say, hey, this is what's going on. This is what's happening in our community. This is what's available to you all. You'll see the mutually reinforcing activities again. That's what we're all about because, again, I usually start out presentations with somebody saying like, hey, if we have a silver bullet or somebody comes and says they have the silver bullet to the workforce problem or to reentry or whatever, they're probably lying to you, right? It can't be done alone, and we can do it together because there's so many reinforcing activities that we do. And I just go to say, like, somebody need help with a job search, where can they access some of that technology, right? It's huge. That community presence, again, being engaged with the community locally, I think that is such a huge thing. And finally, as we start to finish up, is that training piece. Mental health first aid and trauma informed care. Those are two certifications that we offer, and my branch offer to individuals, and not to individuals as far as John Doe's on the street, but to our partner organizations. And I'm going to talk about mental health first aid first, and I'm going to give you an example. If you have an individual that comes into the library, I just want you to think and ask yourself: are we prepared, or are you prepared to be to deal and to assess and to help that individual in the best way possible, right? I would venture to say that you have individuals that you suspect may be experiencing mental health needs that come into the libraries and that you interact with. And so are we equipped to be that first line of defense, right? Those first boots on the ground that person's coming to, and to get them the help that they need, right? Mental health first aid is a national certification. Some of my team members and I have been certified to be instructors for adult mental health first aid. And I will tell you, I've been in this space for a while. I've always tried to be mindful of mental health needs and just how that's kind of a hot button topic right now. That training opened my eyes so much. And so much so that I will show you an example. If you can see my picture here, sitting right beside me with an arm's length, I have the mental health first aid participant guide, right? Where I went through the class and I have utilized this on a weekly basis since I've taken the class. And I think it's huge. It's so valuable as far as training for anybody that is community facing, that really seeks to serve the community. And so we offer that. We'd love to partner and train staff and train community members and just kind of make that a thing in our communities, because the more people that we equip to help be mental health first aiders, right? The better our communities are going to be, and the better our communities are going to do. And really, where it comes down to it, the better those participants and those individuals, those people that we that we interact with, the better outcomes they're going to have, right? Secondly, trauma informed care. This is another one. Not just because we teach it, but I think this was one of the most impactful trainings that I have ever attended. It is one of the most impactful trainings that I've ever taught. I have taught, again, you can see 549 some odd people over the last year. Every single time that I teach a trauma-informed care class, I come away with a new gem, new way to think about things. And I just absolutely love that. And so for both of these, not only is it targeted at equipping staff, right, equipping the people that we are training with the ability to serve the public, but also sometimes we have to take that lens and turn it internally, right? Understanding, our own, right? In trauma informed care, we talk about burnout. We talk about secondary traumatic stress and how sometimes, outside factors impact us, and how do we deal with that, and how do we be that good coworker? How do we make sure that we are supporting the individuals on our team, the individuals we're working with? How do we deal with that? And some of that self-care, right? And it's stuff that a lot of people don't think about until it's a problem, right? You ever thought, think about, taking a mental health first day or mental health day, right? I remember a time when I, in my professional career, that wasn't even really a thing. But now, we hear people talking about that. So really equipping not only for the people, but for our people, right? The people that we're working with every single day, our partners, knowing how to recognize some of the things going on, and asking those questions is not, hey, what's wrong? It's, hey, how can I help? Again, I'll say both of those trainings, super impactful. We'd love to come offer it. I love teaching both of them. And they asked me, they said, will you travel? We will absolutely travel to come provide those. So if you're interested, please let me know. Send me an email. We will get something worked out to be able to come and offer that to you and your staff. And so this is it. Our new Kentucky home is created when stakeholders, from judges to jailers, workforce practitioners, understand the resources available and see their role in helping all Kentuckians turn their dreams into reality, right? You can plug in libraries, library staff into that state, and it doesn't make it any less true, right? That's something that is super valuable, and that's exactly what we're working for. We want our communities to be stronger, to be better, and that starts with really pouring into those people that we serve. Final slide, right? I want to share some of the great things that are going on. I want you to really look. You can see my pointer. This is one of our participants in the Senate Bill 90 program. That's his first day of school picture just a couple weeks ago, right? That's a reentry individual that is going back to school and doing the great things. This young man here, you can see his big smile as well. Working through the workforce system, got his CDL taken care of. Now he's driving the big Mountain Dew truck. And again, just hearing those stories and seeing those stories is so huge. This is down here. This is all the partners that we bring to our pre-release classes and our targeted orientation classes, right? And I'll draw your attention over here. This is one of our targeted orientation classes held at a adult education center in Butler County, Kentucky. And those are individuals that are taking those next steps to work on the various different things. And then here's a picture of our pre-release classes that we host inside some detention facilities. And so I just say that to say, I can talk about data and stats and all the different things, but this is what matters. These two stories here, these individuals that are doing the next right thing, getting access to what they need, that's what it's about. And there we go. That sums up, I think, hopefully within due time, the webinar, my presentation here. That's how to get a hold of me. And like I said, I'm going to point it out again. That phone number that's listed, that's not my office phone. That's not a phone that rings to an answer machine. That is the cell phone that I have right here in my hand. It sits beside me, or it's in my pocket just about 24/7. So feel free to reach out, shoot me an email, shoot me a text, give me a call. If you want to talk about anything we've talked about today, if you want to start activating your facility or your library as one of those focal points for the targeted orientation class, if you want some training, if you want to offer training, to not only your staff, but maybe some of your community partners as well, we would absolutely love to come and do that. but again, I hope that you have learned something that's given you kind of something to think about, and I do hope to be hearing from you very soon. So with that, we have a couple minutes, I think, for some questions, or I can just turn it back over to Miss Hillary and hope to hear from you soon.
Thank you so much, Aaron. I don't see any questions in the chat. I have put some links in the chat, and then I'm also going to put a survey in the chat. But Aaron, I've got a question myself. I know that I've shared a little bit on our KDLA's listservs about what the responsibility of the library who's hosting a targeted orientation session would be. But is that what kinds of things would the library need to be aware of or to prepare for hosting a targeted orientation session?
Sure. Usually just the space, right? Just the space, and we would ask, of course, to share it on social media and stuff. But we do most of the time we do it classroom style. So just 10, 15 chairs and the space for individuals to come in and be able to say, "Hey, this is what we do." We also, if possible, maybe like some individuals to be able to meet with some of these partners off to the side in a more one-on-one setting. And I'm not meaning a closed door, but just somewhere where they can go and have a conversation, have a deeper conversation about their needs and stuff. But really, that's it. Just the willingness, the date, the time, and just being able to facilitate, some additional folks coming in and hearing it. And usually they last between an hour, hour and a half. In some of the locations, I've noticed that some of my team has become really good friends with our partners, and so the class will be an hour, hour and a half, but there'll be 30 minutes of extended networking sometimes. So that's always a really cool story to hear.
Oh, that's fantastic, Aaron. And then another question. You touched on this earlier, but some of our libraries serve as GED testing sites, and also our Kentucky Career Center access points. If a library staff wants to be a part of the target orientation presentation, could they say, "Oh, well, by the way, we have," and even if they're not one of those two, they're not a GED testing site or a career center access point, could they share about, "Oh, did you know that we have Learning Express library database?" Or would they be able to talk briefly during those orientation sessions?
Absolutely. We would be happy and glad and grateful and that would go past targeted orientation if you wanted to do our pre-release classes or really anything that we are involved in that I've talked about today. We're absolutely willing to do that. And I'll even do you one better. If you have an idea from what you're talking, y'all know your communities better than I ever would, right? So if you have an idea of like, I think we should do this, or I think we can impact a lot of people like this, let's have a discussion. Let's talk about it, right? But absolutely, anything that we come to, I think again, libraries are such a valuable resource, and to be able to take and continue to educate people externally, right? That's going to be huge. So absolutely, more than welcome to come to anything that my branch does.
Thank you, Aaron. And my last question, please, anybody else, if you've got questions, feel free to put those in the chat. What is the cost for the training that you mentioned? I think I know, but
Yeah.
the
So trauma informed care is absolutely 100% for free. There is a small cost associated with the mental health first aid. And the reason for that is it's the materials that we're paying for. We're not going to charge anything to come and do it. We just have to get the materials taken care of. And we like to get a little creative. We might seek some external funding, but if that's something that you're interested in, that's something that we can definitely explore. The books that serve as such a valuable resource, if I'm thinking correctly, are about $20 a book. But this has been one of the best $20 that that I have ever spent for my own purposes. But like I said, there's a small cost, but it is a national certification. We do have to get the materials from the national board to offer that, and of course to do the certification. So minimal cost that sometimes in some instances could be taken care of through alternative funding routes, and that'd be something that we would love to work towards and have a discussion.
Thank you, Aaron. Thank you thank you, Aaron, so very much for presenting today and for your willingness to engage with libraries and for cheerleading for libraries too. Multiple times you've done that throughout this webinar. I